Good morning, everyone. Welcome to Pediatric Grand Round. Thank you for joining us in person. If you're near the Mill Mountain Conference Room in Tanglewood, please come down and join us. If you're online, welcome. Before I introduce Dr. Karina Miller, who will be our speaker today, just wanted to take a few seconds to say fond goodbyes and thank you to our longtime CME coordinator, clerkship coordinator, residency person, Ms. Janie Woods, who will be moving on. She is, I think might be her last day. We do have a photo frame in the back if you want to sign it, and it'll be on Vicky's desk for the rest of the day for any of our specialty people who are in the building wants to come by and say goodbye to Janie. She will not be going far, so we will track her down, although she probably did not want us to do that. But thank you for everything you've done over the years. She's been with Carilion for 23 years, and with the clerkship for 7 right now. All right, thank you. Our speaker today is Dr. Karina Miller. She's a graduate of the College of Dentistry in Brazil and completed her pediatric training in Brazil at that time. She went on to serve as a lieutenant pediatric dentist in the Brazilian Army for 3 years. After that, she moved to University of Florida to complete her American training in pediatric dentistry, residency, and fellowship. While at the University of Florida, she joined the Department of Periodontology and became interested in research. She was engaged in the research of periodontal disease of children and resulted in 4 publications and 2 research awards at that time. She has continued her work and in 2017 joined the Carilion family, where she continues her work with the underprivileged population, hospital dentistry, and as part of the craniofacial team, which she greatly enjoys. Never mind how many times a day we bother her. Please join me in welcoming Dr. Karina Miller.
So, good morning. You have camera too, or just the audio?
There's camera too, they can see you.
From where? That?
Yes.
Well, okay, good morning. I do, so gracious of you guys having me here. And when I hear you, my bio, it sounds so good on paper. Wow, she did all that. It was, God knows what I went through. I had to do all that. But it is my privilege. I'm getting a little hot. It is really my privilege to be here today to speak about something I'm very passionate about it. And while I was in Brazil, I did private practice, I did public health, but I really, really fell in love moving to America, learning about hospital dentistry, and seeing the disparity. Even though Brazil is a country that is not fully developed, I have seen the most amount of caries in my life here while doing my treatment here. And then moved to Roanoke. Wow, it really opened my eyes for the needs and the cultural differences and what I can do with. So I was telling Jenny, I have lectures ready of so many subjects in pediatric dentistry and several different particular disease. And it could be easy for me, let's just go ahead, pick one and talk about it. But it just quick dawned on me, we just moved to Tanglewood. All specialties are here together. And today I just saw Dr. Pierce in front of me, and somebody said, "Good morning, Dr. Pierce." I'm like, oh my goodness, you are Dr. Pierce. I write in my charts so many times a day. Who is your physician? Who do you have a specialist? And I know the name of all these physicians, but I don't know you guys. So now we are together, we see faces, we are recognizing, it's easy to talk. So let's talk about multidisciplinary management of the pediatric dental patient. So the disclosure, I have no relationship, I don't get paid for any of this, if I say any brand name. I'll introduce us quickly. We have just recently joined the practice, Dr. Zahid. and we are both a proud Gator alumni. We both came from the same program, and it was so funny when we were recruiting. I called the program director, the chair. I said, okay, I really need someone passionate about the underserved population. I want somebody happy, bubbly, because the work is heavy. You get really very significant families that they really need happy and firm and person that can handle all this. He's like, well, I have a mini you. Do you want? She definitely, we look alike. It's funny when we are all gowned up, people get us confused. So we are happy to have Dr. Zahid with us. And in an adolescent clinic, we have the hospital general dentist, Dr. Moore, Dr. Swanner, and Dr. Humble. So we have the other doctors join us here now. We are all together. If you have not been our practice, please come do a tour. It's so beautiful. It is so nice that we are all together. Also work in a multidisciplinary way. I love to be able to walk a few steps and ask questions when I see permanent teeth. That freaks me out. So the objectives of this CE will be to raise awareness of the interdisciplinary approach to the pediatric patient in oral health. We would like to highlight the challenges that we face when we're responding to the such diverse oral needs and urgent oral needs we have in this area, and also the term long-term maintenance and management of adequate oral health. And one person that is here, Dr. Permishua, she absolutely blows my mind because the amount of time that she spends and the passion she has for her patients, and very passionate about teaching and educate the patient in the overall view. I think there are a lot of physicians in the world, but especially in this country, are missing the point that we are trying to treat like different areas, but we are forgetting that all those different areas are attached to one body. And Dr. Conkle, the one that started the dental program at Carilion, he always says, I don't know whoever decided to take the mouth, detach to the body, and start treating. It would be amazing if we could do that, remove the mouth, because you have no idea how hard it is to restore a second permanent molar. It is a nightmare, and that's why we have all this. I was saying, I feel like I'm 80 years old today because my trapezes are all punched. You have to keep going to PT and doing Pilates and all that kind of stuff so you maintain your health. But putting the mouth back together in the body makes sense. And my goal today is to raise awareness that every single one of us has a part in the overall health of our kids. So the most important of the oral health, if you think about, if a baby tooth, I hear every day, why do you want to save this tooth? It's just a baby tooth. If I had a coin for every parent that says that, I didn't need to be working. Loss of primary teeth can be devastating, right? It damages the permanent teeth. It affects the oral health because it will affect the child's sleep. It will affect the intellectual development, the self-esteem, and so many other social developments that can affect. So to understand a little bit of what is the caries activities, it is way more complicated than this. But it always started when one guy studied the model that caries doesn't just happen. It is a multifactorial disease. It is transmissible, so we have to keep this in mind. It is a chronic disease, so we don't cure from caries, we manage. So I tell my patients, think about diabetes. You don't cure from diabetes. Once you have, you manage. So once you have the caries, once you acquire the strep mutant, you manage the bug. That's how you do. So the ecological niche is in humans, and the transmission is vertical and horizontal. It is inverted here. The number one transmission is vertical. When we say vertical, it's because it's from mother to child. So that's the first transmission. When the baby's born and the mom wants to kiss the mouth because it's so yummy, the end. If the mom has the cavity, the baby already has the caries, And from now on, we just have to manage that baby. So what does the strep mutans will do? Mutants, they live by metabolized, they live by carbohydrates and sugar. So they're gonna eat those things and they're gonna metabolize sucrose that will produce later lactic acid. And the lactic acid, that's what dissolves the enamel. And then once it's there, many other bugs will come, different than strep mutans. And then they're starting producing other type of acid, and it goes and penetrating the dentin and go to the pulp, and boom, facial cellulitis that you guys have seen a million times. So the pH of the mouth ideal will be 6 to 7, but the pH of the lactic acid can drop the pH of the mouth within 6 to 4 minutes. So the whole thing, sippy cup and bottle, has really little to do with what the bottle can do to your teeth. Has everything to do with what is in the sippy cup and bottle, because you're constantly sipping. I mean, America is amazing. I love America. I moved here. My husband's from here. I have never seen so many practical people in my life. I mean, your brains look in the way. I'm like, oh my gosh, this is so much easier. We do like this to get to here. Americans find a way to do it quicker. And then they invented the non-spill cup, right? That's amazing, so practical, because now I can put the juice, give to my baby, and there the baby goes. Let's walk and talk, and let's play, let go, and sip another juice, and then play again, and then sip it again. So the moms lost that control responsibility of controlling what the child is doing in the intake, right? So imagine that baby sipping milk or juice, 58 grams of sugar every 4 to 5 minutes. The pH of the mouth in 4 minutes drop. Can you imagine? And then in 5 minutes, another sugar. 5 minutes, a little more sugar. Next, you know, the pH is 2. Party in the mouth, that's what I say. Bugs everywhere. And then we start the demyelinization process. And there's no brushing teeth that can control that, okay? So remember that it's frequency, not necessarily what you're eating, but the frequency, okay? I'm trying to move, there you go. So then Newborn came with a new model. It is just, I didn't talk about this model, which to have in the cavity, you don't need only the sugar. You have to have the bacteria, the transmission. You have to have the tooth, of course, and the sugar. And then all together combined and lack of hygiene, then form the cavity. If you never had acquired strep mutans, you can eat sugar all day, you will never have cavities, okay? And then the modified model is so complicated, because then the carie risk will be more individualized, right? Because now we have all these other things, society, that are changing. The personal factors, the oral environment factors. Now you have crowding, you have a cleft baby, that the anatomy of the mouth is completely different, right? And then you have the income, the wonderful programs, Chip and Wick, all they give to you, juicy juice, you know, all carbohydrates. They give the right cereal, so the baby, the moms will put in the bottle because the baby's not sleeping well, so maybe if the stomach is heavy, they will sleep more. Wonderful, now we're introducing carbohydrates to that baby, and the baby's not even, there's a study that shows that whatever the 12 months of life, what you introduce to the baby, that's what the lifestyle is gonna be from there on. And to break that and to change that is very, very hard. So the newborn model is way more complex, and it has to do with us now. Now we can intervene so many other factors that we have to take in consideration, individual by individual. So we foster the treatment of the disease in the process instead of treating the outcome of the disease. So let's quickly go through an overview what early childhood caries is. There's no more, I mean, many of you know already know that we don't call bottle decay, rampant decay, baby decay, or a lot of epic. It's actually, Dr. Permishua, it's interesting how the first grand round, like 3 years ago, we talked about this. Immediately after that, the referrals change, where the physicians are writing early childhood caries, because a lot of the referrals I have in the EPIC, they put it a medical history periodontal disease for every baby that has cavities. So I have to change in EPIC. But it is early childhood caries, and those are quick facts that are very alarming, but it's very current. 1 in every 5 American children go without dental care. And then more than 40% of children have cavities by the time they reach kindergarten. So remember that old saying, oh, you need to see your dentist after you complete 5 years age? You know what happened when they come to me at that age? Full mouth extraction. Or they've been to the hospital way before they come to me. So that model has shifted significantly ever since in pediatric dentistry for a while, but now it's been about 10 years that AAP introduced that model also to your guidelines, that you need to establish a dental home by the time the first tooth erupts or first year. 1-1, that's how we would say. So another alarming factor is that children with poor oral health, they're 3 times more likely to miss school as a result of dental pain.
Could you say that again?
Oh, sorry.
I'm having trouble hearing you.
I'm not speaking to you. That was Siri. Very, very nosy.
Jamie told you everybody could hear everything.
Oh my goodness, you I better be careful. So there are, the new study 2017, they released, there are over 34 million hours of school missed due to dental pain in 2017 in America. That's very alarming. But why I put that picture there? Because you're gonna see this baby, you're gonna look in the mouth, and you're not gonna see anything wrong with that, right? But this is already in our guidelines, considered severe early childhood caries. So it is in 2, we divide into early and severe early childhood, which is SECC. The severe early, why? You see here the demineralization around, you see the white. So if you get a gauze and wipe off the baby's mouth, you immediately see the white spot lesion. So the white lesion, it is cavities already. It is the lesson at, I need water. Already acting on demineralizing the tooth structure. If they only have 1, we consider, he didn't need to go. We consider early childhood caries. The minute they have 2, it's already severe, because at this point it's going to spread quickly. So if you don't start remineralization process at this stage, this is a baby that is not even 1 year old yet. If we don't start now, fluoride adequacy, changing habit and all that, this kid will be in a surgical center within 6 to 7 months. Because the enamel of a baby teeth is 2 to 3 times thinner than adults. That's why we are so aggressive preventers in pediatric dentistry. Okay, so another fact is that 2.1 million room visit for dental emergency in 2017. And it's all emergency that can be 100% preventable. $45 billion was lost in productivity in the United States each year because of untreated dental caries. Those are facts that they're very alarming. Thank you so much. I appreciate. Thank you, Dr. Tennis. So there was this study in 2010 that said that children that reported having recent tooth pain, they were 4 times more likely to have low grade point average, and they were below the 2.8, comparing with children that never had oral pain. Isn't that, I honestly, if that study never came out, I wouldn't know this. I know that I'm overwhelmed seeing patients all day, but then we get lost in all that, and we forget what's actually happening around us, right? So, and that's the saddest one. The dental care, it is the most prevalent unmet health care for children with special needs. This, to me, the reason why I decided to work in a hospital dentistry, because they deserve the best. So what can you do, non-dental healthcare providers? You are in a perfect position to be the front line of detecting and guiding your patients to the right way to achieve overall health. You can start prenatal, because we know that once the mom already waiting, expecting the baby, that's when we need, even if they have so many bad habits, in the overall, because I mean, it's not always like that, but once you become a mom, you do worry more about your baby than yourself. So if you start educating the mom things and consequences that could happen with the baby, there is a higher chance that she can make some changes in habits. There are beautiful studies showing the mom, like treating the whole stigma of don't treat a pregnant lady wrong. We need to treat. There are guidelines how to treat expectant mothers in dental emergencies. We can do safely. It is better to treat rather to allow the baby being born and then she has all this infection in her mouth. Now we are already contaminating the baby. There are other oral health problems that can induce premature labor and all that. So health and starting early, prenatal is important as well. And also, because the kids will come to you guys with more periodic visits, it's easier for you to do a quick look and say no and refer and start them. And oral health is important. It's part of your overall health. Especially the specialties, pulmonology, cardiology, GI, whenever the child has a special healthcare needs, the parents are so overwhelmed with, because the kidney and the heart is so more important than the tooth. But then it's a catch-22, because now you're taking care of all of that, and now the child is 5, 6, and now they have this massive infection in the mouth. Now everything else is falling apart because the mouth was not taken care, and it's a very bad cycle. So this is when care needs to begin, the minute we do. And the multidisciplinary approach is so beautiful, and the cleft clinic and the craniofacial team, that's how we work. And if you look our model, the way we started to work, it is all areas are together, and we meet and we discuss, and we are understanding the overall need of a patient. So it's quickly addressed. We don't let anything fall apart, right? So I think we are here together. We're in the same building. We can talk. It's a phone call. It is a walk. I heard a voice on my window the other day, and it was a gentleman, and I'm like, what is he wanting? So I step out and said, sir, may I help you? Everything okay? I was gowned up, and he looked at me. It's like, yeah, I'm trying to schedule a patient. I said, okay, they can schedule, but then I saw a badge. I said, is that your patient, or you work here? Oh, and then I look at his badge and said, oh, you're Dr. Gay? Yes. He walked all the way to my window because he was so concerned that his patient, his cardiac patient, was having some toothache. And you know what? I know that so many of you have expressed the concern that you cannot get with us, you cannot schedule a patient. And believe it or not, my wonderful right hand is right there. That's Miss Melissa. If you really need anything urgent, I'm sorry, Melissa, your phone's gonna blow up. My front desk, I am gonna tell you, they are overwhelmed. And they know they have their limitations. And we are in a process of a change. And I always tell everybody, it's growing pains. We are in a process of change, of training, so they can better assist you all. But if we do have an emergency, it is really my pleasure to just give me a phone call, send me an email, walk to my clinic. I'm there. You guys have the badge, you can open the doors, or call Melissa. We will take care. We do give priorities of emergencies. Dental pain, I'm just gonna go ahead and say, it's not emergency. Otherwise, I would never work in my life. I stop working, never rest. Dental pain is a true trauma or odontogenic infection. Dental emergency. Dental pain, we're gonna manage until we can, because it's a consequence of a chronic condition, right? But if you end up with an infection or a trauma, that's an emergency. Or a cardiac patient or another patient that needs, that's also an urgency. So the goals are for us to improve the overall health of our population, and also facilitate the coordination. So how many patients have told you how happy they are that they can come here and see you, and me, boom, and now we have to go and eat salad chick. I mean, they travel from West Virginia or Whitfield. Oh my goodness, Dr. Miller, I cannot wait to go to Chick-fil-A today. I have a cleft patient. They travel 2 hours to see me. And I'm trying to refer them over, oh no, we come because I love Chick-fil-A and my husband takes me to take Chick-fil-A. So they're so excited that we can all see everybody and then go to Chick-fil-A and Panda, and now we're gonna have more and more. And then Aspen Dental in the middle, right? Maybe they can do a dental. Even my daughter said, Mom, why they put a dentist in the middle of all this food? It doesn't make sense. But I'm sorry if anybody's here with that. It's just, we're all here together so we can take care, we can eat and clean and all that. All right, and so that's our goal. We just want overall health. So why we're gonna do multidisciplinary approach? I mean, we can talk about this over and over and over, but bottom line is no single health professional has the expertise to require a full rehabilitation of the patient. Do you agree with me? Why do I say primary care team is the PCP, the MDs, and the pediatric dentist? Because I say to the cleft clinic patients, I said, at the end of the day, I'm the quarterback because the babies will see me every 6 months. In the beginning of life, they see me weekly for 3 months. It's a marriage with the cleft clinic. To the point that they know each other. Okay, did your daughter do good in the exam? I mean, we know each other's life because we are seeing so frequently. And why I say I'm the quarterback, because the craniofacial, the journey of a cleft patient has specific target and goals that if you miss, you really mess up the future of the child. So there's specific surgeries that are first year, second year, 9th year, and then 10, and then 15, and then 18. Those are things, if they are not connected with a good PCP or a good pediatric dentist, we're gonna fall in the cracks and we're gonna miss the target. So we are seeing those patients with a lot of curiosity. So I have to know what's happening in genetics, what the pulmonology, the child development, neurology, I have to know because these kids are coming now to me. And then in reverse, because when they become teenagers, they come to us, but they don't go back to you. They don't wanna go to the doctor anymore, but they wanna go to the dentist because they wanna whiten their teeth, they want braces. So now we are detecting other diseases in the adolescent and doing the risk assessment and then pitching back to you guys. Okay, now I caught this, and I'll refer back. So it goes both ways, right? And parents, the team works always better, and we're gonna individualize the treatment of each child. So are we treating cavities or caries? Unfortunately, it's still not fully, overall population don't know what caries are and cavities. So caries is the disease, remember, chronic disease, transmissible, caries. Cavity is the consequence of the disease. You can have caries and never have a cavity, right? But if you have a cavity, obviously you have the disease. So by tackling the caries in the early stage, we can avoid the cavities. We can avoid the consequences of a cavity, which is odontogenic infection, early tooth loss, and all the other issues we already talked about, okay? So there are 2 ways to approach the caries management, which is the medical model. It is the model that all of us can adopt. Preventing from occurring and stopping from progressing. And the surgical model, I mean, that's what I do. I do both, but without dealing with the actual disease, the surgical model will not actually be as efficient, because later in the game is worse the way we can do the surgical approach. Dr. Permishua in her BBB program is pretty amazing. So she is really doing the medical model management of caries. So the patient can come to me and we can continue maintenance of that model and not necessarily go to full rehabilitation, right? But they have their strength, both of them. However, we need to focus on eliminating the consequences to get to the surgical model. So we're gonna do control of the bacterial infection, so educating moms, educating patients. And one thing, when you're educating moms, really look at the patient, because the moms nowadays, they're literally Snapchatting and TikTok when you're talking to them. So if you talk to the 3-year-old, they're gonna listen to you and actually follow what you do way more than the parent. It's amazing what a dad told me the other day. Dr. Miller, now you just like ruined my life. I'm like, oh, I'm sorry. It's like, I cannot even sit on my couch. My baby's like, Dad, it's time to brush teeth. Dad, I cannot go to sleep. Dad, because I say, now you're the toothbrush boss, okay, man? You tell your parents it's time to go to bed and brush teeth, and they love it. I mean, kids love to be in charge, right? So let them be in charge of what really matters for them right now. So what is remineralization? This is very complex, but whenever you remember the white spot lesion, that's a stage 1 of cavities. If you start now with fluoride adequacy, that enamel, fluoride has fluorapatite. Enamel has hydroxyapatite. So enamel is a crystal and is a mash of hydroxyapatite, and it goes all one way. Whenever the acid attack, it make it porous, and it kind of change the crystal, and you have holes in the crystal. Whenever fluoride comes, incorporate in the enamel and forms a fluorapatite, which is 10 times stronger than hydroxyapatite. Now the fluorapatite is harder, and it goes into a mash. You still have this spot, but now it's hard. So that is remineralizing the tooth. It doesn't cavitate. But if they keep on the sippy cup, that white spot will collapse, and that's when it becomes a cavitation. So if we see the white spot and start the fluoride varnish application that you guys are doing in the office, that's amazing, because now we are remineralizing. Okay, let's change. Don't drink sippy cup anymore. Let's do Propel water, has flavor. And I'll share a story in just a little bit. So, and then we're going to continue at the dental appointments, follow up and management and all that. And then why is so much challenge? Sorry. In responding to the urgent needs, we don't have enough numbers of specialized providers. I don't need to break this news to you because most of you are pediatric. But it's important to emphasize that kids are not small adults. Isn't that so interesting how the general consensus that we can just treat kids the same way we treat adults, and they're not? In dentistry, it's the same way. Everybody knows how much I cringe when I see permanent dentition, because it's different, it's completely different approach, completely different, you know, the overall technique is the same, but kids are not small adults, it's different. And the residency in pediatric dentistry became one of the most competitive now in America. It's so hard to get in. as hard as oral surgery. So you don't have enough, kids don't want to go that long in school anymore. All the school loans, we're going to reach an era where we're not going to have enough healthcare providers because even our population, you look in high school, how many kids in high school wanting to further their education now? Right? So we're going to start reaching an area where we're going to be scarce. We don't have reimbursed incentives. Medicaid, the state funded insurance, they don't reimburse. And dental material can cost you an arm and a leg. Dental materials are so expensive. And for you to sustain a practice and see the state funded insurance, I have a friend, actually she just texted me this morning. She opened this beautiful private practice, very passionate after residency. I want to see special healthcare needs. I want to see all the Medicaid kids. Well, 2 years into, she had to cancel. She was literally paying to see those kids because she couldn't sustain. Only hospital, big corporations can sustain that, unfortunately. So we healthcare providers, we need to keep fighting. Right now, the APD went to the Hill in Washington. It was March, 2nd or 3rd week of March, and we proposed a bill that we want to increase the age of the patient to be seen in general anesthesia because now the insurance decided to tell me, how many years I went to school, as she said, right? I did 2 residencies in pediatric and fellowship, and the insurance tells me, you can only take a child or sedate a child if they're under age of 6. I don't know you guys, I have better luck treating under 6 than 7-11. I say the 7-11, I don't know what happened to that population. They're either amazing or they're really devils. I mean, they can crawl walls, they can be taller than me, anybody can be taller than me. It's so hard, and they have this massive need, and I cannot take them to the GA. And then we had to do a peer review. And then the insurance, the doctor, which is a dentist, she says, what is their Malin-Patty status? I'm like, we're not talking about this. This kid cannot cooperate. She has an abscess. She almost broke my arm. I can't do anything. Nobody can. She needs to be sedated. Well, but she's healthy. I cannot justify her to go under general anesthesia. She's healthy. Well, what do you mean she's healthy? She's not healthy. She has a dental abscess. Oh, she doesn't have any special need. Well, she does. She will not. She has a dental abscess. She's special at this moment, and she almost broke my arm. But what is her Malin-Patty status? And then I got so aggravated. I said, do you even know what you're asking me? Do you know that that's what anesthesia will do? For me, I need the child to be treated, to be put to sleep, so I can help her be healthy. The Malin-Patty status and all that, anesthesia will do evaluation when they're about to intubate the child. And that has nothing to do with you approving the child because of behavior. So I said, you know what? And this is what I told her. I said, it's okay. She's going to go because what I tell the patients, go to the ER. Because then they go to ER, and then it's immediately, the minute you check in, it's $750. You're going to pay for it. And you know what I'm going to do? Oh, I cannot do anything. Can you book an OR? And then they're going to call me. I mean, it's going to be midnight. Who cares? I'm going there. But now you're paying ER visit. You're going to pay a CT scan. And then you're going to pay my emergency OR after hours. How much do you think that's going to cost? Yes, insurance are telling us what to do. And that's the challenges we're facing. So it looks like we got some good news. I'm going to have a meeting. I'm part of the board now with the Virginia Association. It looks like it's about to pass. So finger crossed, we need to increase there's many other bills we're fighting, but this one is a big one. And why do I say complication of surgical model has a high risk? Because Dr. Tamez patients, for example, and Dr. Gay patients, a lot of their patients, anesthesia will say, you know what? For you to coordinate an OR visit with anesthesia for a child that has so many other problems, It's complicated, it's risk, and now we are balancing risk factor. We need to treat caries, but now this child can die under general anesthesia. So we don't want to get that far, right? So let me jump here, because I can keep talking about over and over. So this is a surgical model. I'm going to quickly talk about this case. This is a child that was put under foster care, came to see me, and she was only 3.5, almost 4. And this is how her mouth was presenting. The reason you see black is actually good news. When she first saw me, it was all red gums and bleeding, and I couldn't take picture because she was in so much distress. She was taken away from her parents the same week she saw me, but she was not eating. She was lethargic. She was failing to thrive. And then I applied as silver diamine fluoride, and I would love one time to just talk about that, which is medication that arrests and kill the bacteria. And every time you arrest decay, it turns black. So if you see a cavity that is black, it's good news. Means that the number of bacteria in the mouth had diminished and the cavity will not go any further. If it is white, yellow, or beige, means that the bugs are all wiggly and happy and will keep going until it gets an abscess. So I apply, so the child, until they wait, the wait time for me to go to the hospital is about 3 to 4 months. And do you want to know how, for the heart patient, the cancer patient, the pulmonary patient, we need to go to Roanoke Memorial. Know what is my wait time right now? Yes. Over a year. Do you think those type of kids can wait? Do you think that that's an elective surgery? Well, that's another subject. So we finished. She came back. Literally 5 days after surgery, she put on 2 pounds. 2 weeks after surgery, she gained 7 pounds. And she got adopted, and the new foster mom was amazing and adopted her. And her favorite place to go is to the dentist.
Oh.
What? A child that had so much. I extracted 13 teeth. And the reason I even saved the bottom ones is because, this is going to be her first kindergarten year. And she doesn't want to go to school because she says she looks like a vampire. So she's not talking. So the foster mom, I said, okay, we can do fake teeth for her. So we do what we call a PD partial. Oh, sorry. Look, her fake teeth. And she was so happy immediately. We put it on and she smiled and she talk. And now she came back and look at her new permanent teeth coming in. Healthy smile, healthy kid. I mean, it's a difference. So there is a very beautiful side of the surgical model. The rehabilitation is pretty amazing because now we are setting this child in a good course for adult dentition, right? So this is considered lactic surgery. This is a baby. He was not almost 2 yet. Can you imagine this? This has a straight communication with the sinuses. I have a video of this particular case because I would touch here, it was like a gelatin. Like I would scoop it out, the tooth. That's how I extracted those teeth. I could not do the forceps and remove. I scoop out the tooth from inside the bone. All right, so challenges of our surgical approach. This is a child that was on a transplant. Look at the neck fusion. She stayed in a hospital for almost a year. The hospitalist, not a single day, put in orders for oral health care. I see this in a very, very, very common basis. So I know the kidney is important, the lungs are important, the heart are way more important. But now everything we did is about to fail because this child has multiple infections going on. And now anesthesia is like, I don't want to intubate this kid. She cannot open her mouth. How can I treat those teeth? It was one of the most challenging cases of my life. I was in residency. I could not open her mouth. It took over an hour to intubate this kid. everybody's like freaking out that her pulmonary status was so weak. It was very, very difficult. She had to stay in the hospital another few days after the dental surgery. But that's where we don't want to get. We want you to start educating your patients way early so we don't get to this level, okay? So I'm going to try to briefly go because we are about to run out of time. So asthma, when I go to a pulmonologist, we need to remember that, aerosol and even the carrier of some of the asthma medication has some sugar in it. And most of these kids will have their mouth breather. So we need to always talk about, make sure you see your dentist. Let's drink more water. Don't forget to rinse your mouth or brush your teeth after using your inhaler. So constantly educating these patients, because those are kids that even to treat in my chair, they're very tricky, because if they get to have severe dental decay, anxiety can trigger an asthma attack. Tooth dust, when I'm doing restoration, can trigger an asthma attack. So it is a high risk in my chair when I have patients. So I always tell the patient, bring your inhaler with you. Even though we have the rescue everything in the clinic, the kids, they know how to use their own inhaler better. So when I have a high risk patients like that, I said, bring your inhaler with you, hold with you. Because when they're in my chair, my heart is always like, because they're already walking in the door. I'm like, oh, I have to do crowns and all this. So we want to prevent, we don't want to get to that level. GERD, all these kids, they have so many oral conditions. So they need to be seeing us early on, because there is such high increase for caries, oral ulcers, then they're not going to be eating well. Then they're going to choose poor choices. They're going to be liquid diets. And then just the cycle just keep getting vicious and it's horrible. Heart conditions. This is a child that I thought, this is Dr. Zahid's patient. I have never seen the cat eye syndrome before. Have you? Look at his eyes. Isn't that phenomenal? So, well, they are known for having a lot of cardiac condition. This particular kid had tetralogy fellow, and the way he got to Dr. Zahid was by emergency room with infectious endocarditis, and they had to do an emergency OR for dental treatment, and then right after another surgical procedure. So this kid within 2 weeks had to undergo 2 general anesthesia, completely unnecessary. And why? That's embarrassing. But this child never felt a single cardiologist appointment. He felt tons of dental appointments. Nobody knew why he was sick. It was until day 2 they decided to lift his lip and see he had cavity in his mouth. Oh, call the dentist. Why did you not see this kid? He's not coming. So they don't fail cardiologist appointment, but they fail us. I had a patient that he needed to do his surgery, his third cardiac surgery, and the cardiologist wouldn't do because he has so many cavities. And they kept scheduling with us. The child kept missing an appointment. And one day the cardiologist called our clinic and said, I postponed this surgery 3 times already. I said, this kid is not showing up. You call them, you book an OR, and I'll be there. I promise I'll show up. Sure enough, cardiologist booked an OR in his slot, his time. Got the kid there. I went there. Treatment done. So in some cases, you have way more power to get this kid in a good health than I do. Okay? This is another case that this child was admitted in a hospital, and it was not until day 4 they decided to call us, because even though she was being treated for candidiasis, she was still not taking PO. She was still hurting. Well, but what's happening? Well, on top of that, we also had primary herpetic gingival stomatitis. And Boom, on top of that, oh, you can see here, I couldn't take pictures. I mean, can you imagine how much distress? She had severe ECC. Her molars were like the nerve were exposed. So when they have candiditis or herpetic gingival stomatitis, everybody gives them popsicle, right? Because it's soothing. But she couldn't do the popsicle because their teeth were so bad. So this kid was a 14-day admission in a hospital. We ended up doing her treatment. But one interesting thing is that Candida has a very strong association with strep mutans. Remember the mutans guy? All right, why? Because Candida used the acid lactic to as an energy power for them. So they coexist. So every time you see thrush, make sure we are, okay, let's take a look at the dentition because those can correlate, okay? So these, what do you think those kids have in common? I saw all those kids 2022. Those were cases, my OR cases the last few weeks. Tell me what they have in common that you imagine, their medical history. Can anybody guess what they have in common? One thing they have in common is the age. You can tell that is like between 2 and 3 years of age because of the development of the dentition. What else they have in common?
Juice.
Yeah?
Never seen a dentist before.
For sure.
Is it because?
Okay, their medical history. What do you think is in their medical history? If I have a student, I would love for us to do a study because I'm so curious because it's merely my opinion right now. Every single severe ECC patient, their medical history, they report they are on some type of antacid. They take laxative and melatonin. So what's happening? Why they're doing antacid? A 2-year-old. Why they have GERD? Why they are taking laxative? They cannot go to the bathroom? Seriously, a child. And why in their melatonin? They can't sleep. Why? So we are putting Band-Aids on top of everything. And where are our dietitian? Where is the counseling? What if we start, okay, what are you eating? Maybe that's why their stomach hurts. Maybe that's why look, did you see the color of the tongue of that child? That was her Capri Sun. Look at all the dyes and all the stuff we're adding to the kids' diet. But then we give Preventable, melatonin, and all that because the kid is suffering. I had a patient that was being tested for autistic, and that's a true story. And also, she couldn't eat. She was on this medication. She came to me just because one of our champs here said, I think you should go see the dentist. She had a melogenes imperfecta. You know what a melogenes imperfecta is? Lack of enamel. So imagine a child that only has dentin. It was where the pain source of the tooth comes. So she was irritable. She would scream. She couldn't eat. We had to put crowns in all her teeth. And now this kid is being like poor behavior, doesn't eat, failed to thrive, and that's all because we failed to detect that she had a condition, a syndrome. So things like this happen every day. The neurology, for example, seizure management. This is a 10-year-old that she has this devastating syndrome, very difficult to treat, but finally she decided, you know what, I'm gonna go to the dentist. My child's 10 years old, she doesn't have a single tooth. Well, she did have teeth, but she had drug-induced gingival hyperplasia. And not a single day in life she ever done oral care because she's in the G-tube, right? So she doesn't need to brush teeth. Well, after we finally took her to OR, it was very challenging to show mom the importance of remove the bacteria and then cleaning. And now this child has her teeth. It was all under the gums. We just exposed the dentition, and now she's amazing. Look at her tongue looking way better. So adolescent is also a special need. This is what we're dealing with, right? So we need to join forces and bring together a world that we can just prevent and put in cardiology into public health and understand it is part of the overall health. We should all together tackle sugar because why in WIC they give this kid so much sugar. It is 58 grams of sugar into juicy juice that is free. And it says in the label, no sugar added. I have a mom that said, Dr. Miller, I'm doing so much better. I'm not adding sugar to the Capri Sun. I'm like, what? So Kool-Aid. But you know, it's funny. Look at me. I mean, I am not formal at all. And I have zero filter. So people can read inside of me in 2 seconds. And then the mom told me that. I'm like, what? Did you put like sugar in your Kool-Aid? I said, no. I have to have this patient, 5 years old, she's going to the OR again. And the mom looked at me and said, Dr. Miller, she cannot stop drinking Dr. Pepper. And it's like 3:30 in the afternoon, and I'm done at that day. And I look at the mom, I said, well, you can stop buying Dr. Pepper. I mean, common sense doesn't come with people. You know, it doesn't. So we have to say, I bought an outfit the other day, and the label said, wash after wear. I'm like, what? Why do you have? So maybe it's the same of me saying to the parents, brush after eating. Yeah, so the people are now telling us to wash clothes because people doesn't come with common sense anymore. So sugar can prevent, you know, diabetes, cardiovascular disease, cancer, obesity, so many things, right? So maybe we should go to the Hill and say, hey, can you stop putting a program, all those sugar and give it free to the kids? Can we do something else? I think we need to start working towards that. I think I ran out of time. I'm good? Okay. So I just want us to recognize caries activities and the same plan and same level as other major chronic disease. If anything you learn here today, just remember it's infectious, it's chronic, it's transmissible, and is 100% preventable. You have way more power than I have. I can manage. I have a mom said, Dr. Miller, can you save this tooth? And the other day was a little bit sassy, and I said, yeah, I can. You will be amazed what I can do. I mean, I'm pretty skilled with my hands, but this is a 2-year-old that I'm actually having issues right now because mom, one of those pictures you saw, I can save, but can you change her habits? Because this crown's gonna fall. This composite's not gonna stick. And sure enough, dummy, saved because mommy's crying and the baby's beautiful. Okay, I saved the tooth. A year later, the child falls and she's drinking juice and it breaks again. And now, oh, Dr. Miller, everything falls. I'm like, oh my gosh. You know, so we can save, but they don't change habits. Nothing is gonna change. Let me just tell you something. Did you know that caries is on the rank of the 3rd most costly disease? I just read this a few days ago. Heart disease has spent last year $363 billion. Cancer was the 2nd with $200 billion. Respiratory disease was the 4th, the 3rd, 150. Dental care is the 4th, $136 billion spent for something that is 100% preventable. So let's all join forces, and I'm gonna finish saying what can you do. Just identify the caries risk, facilitate your patients, establish a dental home, provide anticipatory guidance. Those are easy. There's so many little movies you can watch how to do a quick oral exam. And let's avoid those kids who keep going to the ER. It's so costly and they spend hours and so stressful, and just lift the lip. Dr. Rockhill just told me a story yesterday in her residency. She was in rotation and this kid finally got a kidney and everybody's excited. You know, when the transplant is coming, like everybody comes. It's like when you call the blue code. Have you ever had that? Literally 60 people in your room and you don't even know what you're doing. All I did, it was just like stay in the wall because I was watching it. It's impressive. And it's the same with the kidney transplant. Well, but this kid cannot stop a fever. Well, but she's the first one on the list. She's about to lose the kidney. Dr. Rockhill, I mean, we are resident. We're so dumb, right? We're like, we don't want to say because all these amazing specialists are there. And she's like, have you looked in the mouth to see if there's anything there? Literally, they lift her lip. She did. She had 4 abscesses going. Just lift the lip. Just look in the mouth because, good news, mouth is attached to us. So, guys, thank you so much. This is what I do when I'm not here. I'm running around between dance competitions. I'm exhausted and dance competition is over. Now we're gonna go to recital mode. So I love having a healthy children, healthy life. And I appreciate all of you. I'm very happy to be here now. Dr. Permishua says, can we have more of you? And I say, you are. I mean, we are, because helping each other, I think I have never had so much joy working in the healthcare as I am right now, working with this population and seeing people joining forces with us to achieve overall health. Thank you, guys.
Thank you.